Hello everyone, my capstone is on community health nursing in America, the lost cornerstone of American nursing. Alright? When you hear community nursing, what do you think of? Do you think of health clinics? Do you think of public access to healthcare? Do you think of a preventative care? Do you think of primary care? If you thought of any of those things, then you are correct, right? That is what community health is. It is, in a way, a sister to public health, a little sister, really. Public health is a broader topic where they come up with logistics and laws as to how to implement and to help the population be healthy. Community health is when the individual, the nurses, the doctors, the healthcare professionals go into the community and touch base with the population from that standpoint, rather than having them come to a hospital setting when they are sick. Right? It is a lost art, or a lost this is a lost art here in the US, because not many people do that, especially from a preventable or a preventative standpoint. Rather, we tend to chronic diseases, we tend to maintain or to medicate, right? Home health aids after people have gotten diabetes, home health aids after strokes, home health aids or home health nursing when people are homebound, right, due to chronic illnesses. So there's no preventative form of health here in the United States, right? So I think about these things. Most countries across the world have some form of public or community health structure, right? They're designed to bring greater awareness to healthcare issues, diseases, and to also create legislatures or guidelines to ensure population health. This type of structure is important from the standpoint of preventative, holistic, and equity of care standpoints. Sullivan marks on 2020. Preventative, because most community health centers are part of primary tier of healthcare, which allows for the first contact between the community and healthcare in the form of regular check-ins, preventative screenings, and follow-ups on chronic diseases. This preventative model can also be said to be holistic, and as the whole person is tended to and not just the disease. Equity is explored as a community health is designed to reach people in their communities and homes. This approach alleviates additional costs that may be associated with going to the city, like housing, food, or even transportation. This project will explore community health, public health, and how integrating community health into nursing education at the associate level and the bachelor's level will affect learning outcomes and healthcare outcomes in the United States. In a 2016 report by the NIH, Beck and Bolton was published to shed light on the number of nurses working in the public health sector. It was found that only 15 to 18% of nurses worked in the public health sector, public health nursing. That is, worked with your local state or city health department, right? So Florida health department, Florida State Health Department, or even say a Tampa-based health institution. When one considers the population of the United States, there are 348 million people, all right? And the number of state local departments are about 3,400, right? The number of persons served by each department then is 105,450. All these people are served by 15 to 18% of nurses. Essentially, there are not enough nurses to tend to the population, right? The reason for this discrepancy comes down to the US healthcare model, which is one of the worst models by outcome for a high-income nation, Blumenthal et al. 2024. That is, although there are many avenues for care and enough income to provide care, the outcomes are still bad. I believe because there is not enough importance placed on community health and preventative care, whether by authorities, departments, or the population. Now, we know what the discrepancies are and the lack in servitude and attentiveness to the population. One must consider the purpose of nurses in the public health and community health setting. The task of nursing in this setting is as follows: preventative medicine, serving on the underserved, disease control, community education, policy making for public health, etc. With these things in mind, the nursing deficit in this area of the medical field in the US one can consider what it means to fill the gap and what improvements can be had when the healthcare model is changed and the focus is shifted from a capitalist mindset to a healthy population mindset. The majority of nurses working in the hospital settings is estimated to be about 60 to 70% of nursing population in the US, while only about 15 to 18% are found working in the community. This is generally because these nursing jobs tend to not pay as much or have flexibility afforded to private and large hospital systems serving a large area. However, in doing so, the opportunity is missed to serve the general population and to prevent chronic diseases, to educate the population about health. There is much to be said about the lackluster showing of the United States healthcare model. One way to change this perception and reality is to integrate healthcare into the government's budget, making it a national rather than private, allowing for uniform access to healthcare. We can implement strategies that allow for new nurses to serve their communities for 18 to 24 months or to serve in an underserved area. In doing so, a bond is fostered between the nurses and the community. Better learning outcomes are achieved as nurses see patients at a variety of stages during care, and eventually outcomes for said patients will be improved. These outcomes can be measured at 6-month intervals over a 3-year period by asking nurses about their experiences serving in the community, the satisfaction of the patients, the quality of lessons learned by the nurses, and by following acute and chronic patient outcomes during the same time period for patients during the time frame. That way, a baseline can be had for both nurses and patients. All right, so we'll be measuring outcomes for the patients. We'll be measuring the learning outcomes as well for nurses, especially new nurses. So we'll be implementing it in such a way that after graduation, nurses will be required to serve for 18 to 24 months in the community, right? Directly after getting their certification. And then this will help them to see people in various stages of their disease or before their disease, and to help to formulate preventative plans and to actually reach the community, right? And by impacting the community, then you can impact the city, the state, and then eventually the country. All right. On the flip side, older nurses can be used in hospital environment to see what happens within these settings and outcomes. We can consider the other countries such as New Zealand, Australia, and the United Kingdom, whose outcomes are better than the US. All right. Here are some ways that the US healthcare model, the mixed model, can be improved. Reversing the dismal track record for the US health system would require multiple demanding interventions by the government at all levels by the private sector. To improve equity in healthcare, the US would have to continue to reduce financial barriers to access to our care by extending coverage to the remaining uninsured. Reducing financial barriers would also require the insurance coverage itself meet certain minimal standards of adequacy, including meaningful limits on patients' out-of-pocket expenses. To reduce administrative burden, minimizing the variation and complexity of insurance plans will be critical, as will reducing the cost of care, which is driven primarily by high prices charged by providers. All right, because like I said before, it's a capitalist mindset rather than a healthcare mindset and a healthy population mindset. Right? To make the delivery system more functional, at least two major reforms are necessary. The first is to build a robust primary care system through improved compensation of primary care clinicians and more investment in the training of primary care providers. Right? There is hope that provision of care through telehealth and remote monitoring may improve access and costs, and artificial intelligence may be harnessed to make our complex billing and documentation systems less burdensome. Right? If so, it will be essential for the US health system to put these technological advances to work as fast and as seamlessly as possible. The second delivery system reform would be to address the uncontrolled consolidation of healthcare resources in local markets, which helps drive prices higher and make insurance less affordable for Americans. Right? So once again, affordability is very important in corralling the healthcare deficits for Americans. All right? Then we need to create a valuable public health system. Right? Like I already said, they forgot about community health nursing and community health care and public health in general. Right? And everything is for profit and for and just for the money. The pills and everything like that is just for the money. To create a viable public health system capable of mitigating the burden of chronic disease, organizing national defenses against likely future pandemics, the US will need to expand investment into public health at all levels of the government and increase federal authorities to respond to public health emergencies. So I started out thinking that the problem was at the grassroots in the community, but it has been shown to me through my research that the problem is not there. The problem is with legislature and government. The healthcare model needs to be changed, right? It needs not to be a mixed model. It needs to be a centralized model where the insurance, the healthcare, the and like the outcomes are all defined by the government structure, right? And unified and uniformed so that the outcomes at the end of the day are better. Thank you very much for listening.